The Health Minister, Dr. Phaahla, has blamed budget constraints for the growing number of unemployed medical graduates. Now, the minister says over the past 5 years, more interns have been entering the sector. That's despite many doctors who completed their community service complaining about sitting at home without work, despite a skills shortage. For reaction on the story, I'm now joined by Professor Alex Van Den Heever. A very good afternoon to you, Professor. Thank you for your time. In an ideal world, all graduates who've completed the statutory requirements of internships and community service should get immediate employment in the public health sector. But of course, that's not the case. They do face a number of challenges, don't they?
Yes, well, what's happened is that there is a misalignment between the sort of planning for new doctors to graduate, their subsidization and their absorption into the system. And that alignment is technically very possible if there's a proper and well-functioning sort of strategy behind it. But what's happening is that national government makes a number of decisions that impact on the budgets of provinces, which means that they face huge fiscal challenges in a given year if salary increases and wage increases are made during the course of a year and they are not fully financed, but the liability is shifted to the provinces. So we've had a bunch of whammies that have hit the provinces that have meant that they just are starved of funds and would not have been in a position to plan for it. And that inconsistency, that mismatch is unacceptable because it creates this situation. We should be employing our doctors and our graduating nurses for a significant period after they graduate, because that's how they get experience. You don't just chuck them into the private sector.
So what is needed in terms of processes and responsibilities to ensure that there is no mismatch and the planning goes and works about seamlessly?
Well, so first of all, you shouldn't be agreeing to salary increases that you can't afford. And this is a problem between the Department of Public Service Administration, which clearly made a political decision on the salary increases, and the Minister of Finance. They've got to only agree to salary increases that there is budget for. And they clearly didn't do that this year. And this is about the fourth time since about 1997 that national government has done something like this with devastating consequences for the provincial health departments. It's actually a relatively straightforward matter to sort out. But this is where a national function deciding on the remuneration of staff at a provincial level creates a mismatch. National government does one thing, and then it passes a liability on, an unfunded liability onto provinces that they can't absorb. And they don't have the same taxation powers at the moment that national government has. So when they don't get budget, they're kind of stuck. So that's what's happened this year. And it not only wrecks the performance of the health system, but it means we just have a misalignment in the absorption of new staff that we're creating. So government has been pushing the universities and the nursing colleges to churn out more doctors and nurses, and then it can't absorb them. And that is unacceptable because it basically creates a set of expectations, a very costly educational process, and we're then throwing people out effectively into the street.
And the real contradiction here is that all of this happens with a skills shortage. Doctors are needed.
Yeah, we need doctors. We need them in the public sector. We need them in the private sector. We need nurses in the public sector, the private sector. We need to have a proper system in which we align the number of people who are effectively leaving the system, having the number of people coming into the system equivalent to the number of people leaving the system with an incremental adjustment and improvement. That is what a proper planning process would be doing. And this is what government doesn't actually do. So we just have this misalignment. But we're also facing austerity. So when a 7.5% increase in the cost of employment was imposed on government halfway through the year, we also have a government that is basically wasting and squandering funds through corruption, etc., that is also creating fiscal constraints. And so many of the health departments are in financial difficulties because of that. But the austerity never seems to cut that, but it cuts the essential stuff. So yeah, we need to have a proper long-term plan for our health workforce going forward. We need to know what we're buying, and we've got to actually look at the configuration of staff as well. But we don't really have a planning process equal to the problems that we face in the health system.
So the impact of that, the ripple effect on the actual graduates who've now finished internships, done with community service, and are now exiting community service and are free to do as they please. I mean, we heard the minister speaking about how one is now eligible to go into private practice. What happens to that group of people? I mean, the likelihoods of going into private practice or sitting at home just hoping to find a job, what happens to them?
Yeah, so some of them will probably start off with locum positions. In other words, they would come in and assist a practice when the sort of people who own the practice go on leave or are unavailable. So very often they do locums before they become assimilated into a practice or start their own. But usually it's only quite an experienced doctor that establishes a practice. Mostly you get absorbed into existing practices. So that's what they'd have to do, or leave the country. But doctors at that stage really are looking to make sure that they're getting supervised experience in what they do. They're still building up experience. The other problem that is created is that there was an occupational specific dispensation that increased the salary costs of more junior medical officers in the public service. And what that did was it actually made it quite expensive to absorb the community service doctors subsequent to qualifying. And the problem there becomes it's a trade-off between attrition, not filling posts of more experienced doctors in order to incorporate more junior doctors. And you can't have that in the public sector either. So the problem is that there isn't really a sort of a coherent strategy here. We definitely need to retain our senior medical officers in the state, and we also have to supervise and incorporate and find a route for our more junior doctors coming into the system. But we do need to basically plan this better, and we can't afford to have political decisions made about cost of employment, disrupting an entire health service with 400,000 staff in it.
Yeah.
And that's kind of what happens.
What do you imagine to be the long-term impact of this? I mean, could we see more and more, young people opting to perhaps not even study medicine, and that in itself could result in a higher shortage of the skill?
Look, I think we're seeing a bit of that already. I mean, there's both the people who leave the country, and there will be people reluctant to go into the qualification. It's often been seen as a qualification that gets you employment certainty and a sort of a relatively good income. And that's why it's quite attractive. And the entry criteria are very strict and very, very high and onerous. So very, high quality people go into medicine. Now they will be picking other high-quality professions. So we do want to attract really good people into medicine. We do need them. But we've also got to make sure that we've got a coherent career path available to them. And I don't think that we're guaranteeing that at the moment. We're creating uncertainty. The current public health system should be a relatively stable and easy system to run without this uncertainty and instability. What is problematic is that a relatively straightforward system is basically being mismanaged at a fairly strategic level and creating uncertainty overall. But the key thing is not just what happens to these doctors. When you create this austerity framework around or impact on the public health service with short-term crisis like this, it introduces a lot of uncertainty and in the general management of these services. They go into a crisis mode, and we shouldn't be doing that to our public services. They need to be stable and with sort of a continuous process of improvement. Instead, what we're doing is we're constantly shocking these provincial systems and making it very difficult for them to manage effectively and improve.
Yeah. With this in mind, what sort of approach or, intervention can one expect to hear or should hear as the State of the Nation address goes ahead this week when it comes to addressing the challenges in the public health sector?
Well, one of the, in the past, there have been approaches to examine a sort of a strategic framework for health professionals, to manage key health professionals in the public and the South African health system as a whole. And part of that included saying, well, we need to ring-fence the allocations at a national level for certain of these professions. So, for instance, you would actually ring-fence the allocations or make them national allocations for community service, for instance. That doesn't protect people going into the medical officer posts after community service, but at least it protects them up until that point. And the same for registrar posts, as well as for any community service posts for pharmacists and any other of the allied workers. So what that would do is say, at the national level, budget for those. So we've got certainty of what we are able to achieve. But if what you do is if you leave it up to the provinces when they get hit with these financial constraints, they cut where they can. And then this aspect gets deprioritized, the actual continuity of training. So we basically need to separate between what is nationally funded and what is provincially funded when it comes to training and teaching.
Well. Thank you so much. Thanks for that input. Joined by Professor Alex Van Den Heever, speaking to some of the challenges within the health sector and expectations ahead of the State of the Nation address, and essentially what approach government should be taking to this challenge.